Hi guys, this is Minidivan and you're watching TheHealthSite and India.com. It's been more than 2 years that the schools have been shut all over the world due to the pandemic. But due to the drop in the cases comparatively, schools are gradually planning to open up for in-person learning as well. While some are emphasizing on opening schools, some are against it, especially considering the fact that the children haven't been vaccinated yet. But the question remains, should children be really vaccinated yet? Because the parents are still apprehensive on the success of these vaccines. Let's see what the health experts believe and what's the status of vaccination for children in India.
Although the health experts believe that children are less vulnerable to the Covid-19 virus, the highly contagious Delta variant has sparked concerns about infections in children. Doctors suggest that the children with comorbidities are more likely to develop severe diseases and hence they'll be prioritized in vaccination as well. Talking about the vaccination drive, considering the global efforts to vaccinate children under the age of 12, the Pfizer Biotechnology announced the successful first phase clinical trials of vaccine on the age group 5 to 11 years. Globally, Israel is the first country to be taking the lead in vaccinating children. This year in July, Israel granted a special authorization for children in the age group 5 to 11 who were at a significant risk of illness. Later, even Britain approved Pfizer vaccine for children of the age bracket 12 to 15 years to avoid lockdown during winters and to target the reopening of schools. Germany is another country that has started vaccinating all the children above 12 years since August this year. Talking about our home country, the Drug Controller General of India in August granted the emergency use of authorization to the Zydas Cadila ZY-CoV-D for use in children and adults above 12 years. The government is set to be considering the vaccination of adolescents in the age group 12 to 17 years with serious health conditions with the 3-dose ZY-CoV-D vaccine starting this October. The Gujarat-based Zydas Cadila is also said to be considering starting trials of its vaccine on children aged 2 years and above. ZY-CoV-D is considered the world's first COVID-19 vaccine built on a DNA platform to be granted emergency use authorization. Besides ZY-CoV-D, Bharat Biotech's Covaxin, SII's COVOVAX, Johnson & Johnson, Biological E's COVOVAX are also waiting for the approval for vaccinating children and adults. Pune-based KEM Hospital and Research Center Serum Institute of India has begun enrolling children for Phase 2-3 clinical trials of COVOVAX developed by US-based company Novavax for those aged 2 to 17 years. The trials for the first group will be conducted for those between 2 to 11 years and the second between 12 to 17 years as the FIT reported. Also talking about Covaxin, the third phase trials are done and the data should be out by next week. Speaking in the Lok Sabha, Union Minister of State for Health Bharti Pawar had said the outcome of these trials will depend on the data emerging from the trial for the purpose of its approval and availability in India.
Well, the vaccination drive in India for children looks promising and bright as a lot of vaccines are waiting just for the approval. Don't forget to like, share and comment on this video and don't forget to subscribe to our channel for more such interesting content.